It's a shocking and scary scene in Monday night's NFL game in Cincinnati as a Bills player, Damar Hamlin, collapsed and had suffered a cardiac arrest. His heart had to be restarted. So exactly what happened there? Joining us now, Dr. Howard Dinh, the medical director of cardiac services for Kaiser Sacramento. Doctor, thanks so much for joining us.
Pleasure to be here this morning.
I think a lot of people don't know the difference between a heart attack and a cardiac arrest. Could you explain the difference here?
Certainly, but first I'd like to acknowledge what happened on Monday was certainly shocking and unfortunate.
Yes.
But people really need to understand that cardiac arrest is not a common event. With regards to the difference between cardiac arrest and a heart attack, a common question I get all the time, a cardiac arrest is when the heart stops, typically because there is chaotic electrical systems going on in the heart, and patients would typically have loss of consciousness or fainting. They may feel fast heartbeats. A heart attack, on the other hand, is when there is sudden stoppage of blood flow in the pipes of the heart, the coronary arteries. Sometimes we refer to that as circulation problem. And that is due to plaque buildup, clotting inside the coronary arteries from diabetes, hypertension, smoking, and high cholesterol. Those types of patients would typically have severe chest pain, shortness of breath, and cold sweat.
But they're vastly different as far as the cars, and that's the important part here. When we talk about what happened to Mr. Hamlin, his uncle said he had to be resuscitated on the field and then in the hospital as well. But the fact that he got attention quick, someone in his situation, if you have a cardiac arrest, the key is medical attention as fast as possible, right?
Absolutely. The recovery time for anybody after a cardiac arrest is really dependent on how long the heart has stopped. And certainly timely CPR and AED, that's automatic external defibrillation, is critical in restoring blood flow and oxygen to the rest of the body. And so that is very key.
When we talk about also the lasting damage of this, there have been reports about his lungs being impacted, him have to be intubated. When you go into a cardiac arrest in general, can it affect your lungs, and what sort of treatments or tests would they be running to test his internal organs like lungs?
Again, I just wanted to say that I am not directly taking care of him. And so in general, in my experience taking care of patients after a cardiac arrest, it is common to be intubated or on a respirator. That is important to protect the patient and to support the patient with the needed oxygen to keep vital organs going. In terms of typically what we're thinking about, the questions I would have when I take care of such a patient would be, number one, what exactly is the heart and brain function at this time? Number two, what are the potential etiologies that trigger cardiac arrest in the first place? And lastly, what are how are the ways in which we can support the patient to get a full recovery? Luckily, hospitals around the nation are very good at answering these questions. And so these are great questions that we need to answer.
One last question here. Could he have, and again, you're not his doctor, but could someone in his situation have a full recovery, or are they looking at lasting damage?
That varies. Certainly, in my experience, some patients would have full recovery, and really depends on how fast CPR was done. I want to just give a plug here. This is important to know for our viewers out there who don't already know CPR. Go learn that, and you can save a life.
Yes. Big time. Dr. Dinh, thank you so much for talking to us. It's nice to get some insight to a lot of terminology that's being thrown around, and important to know, especially as we move forward. Doctor, thank you so much.
My pleasure.
All right, 8:18.